for mental health. My name is Tramaine EL-Amin, and I will serve as the moderator for the panel. I currently serve as the Assistant Vice President at the National Council for Behavioral Health, where I lead corporate and community business development, along with strategic partnerships for the Mental Health First Aid USA program. National Council is a policy and advocacy organization focused on ensuring that everyone across the country has access to affordable, equitable mental health care. We appreciate you for being here and can't wait to have this discussion today that is so timely and so important as we start to celebrate International Women's Day. What I get to do every day is a mix of both my passion for ensuring workplaces have what they need to face the mounting challenges that we're facing in our communities, in our environments, but especially when it comes to our mental well-being. What we are doing today is talking about how those impacts, including COVID-19, social injustices, all the things that are in our environment today, how they're impacting the employees in our workplaces and how corporations and organizations can focus their efforts in tangible ways on ensuring that they're taking a leadership role in addressing the needs of staff and doing so by addressing their mental well-being. I'm delighted to be joined today by Taryn, who's the Director of Social Impact for Kate Spade, New York, and a champion of women's empowerment, corporate citizenship, and well-being. Danica Anderson is a Wisconsin-based mental health advocate and franchisee at Drexel Town Square Chick-fil-A. And Melissa Anderson, a human resources and workplace well-being leader who currently serves as the Senior Director and Business Partner at FIS. Today's conversation will start by asking some questions of our panelists. I'll kick it off, but you will also have an opportunity to ask your own questions after they share their insights. We invite you to enter your questions into the Q&A box throughout the presentation. Our panelists will answer those questions, and they'll answer as many as possible during the open forum. So I think I'd like to kick it off by just asking all of the panelists today. First of all, thank you for being here. And I would love to hear you kind of give us some sense when we talk about addressing mental health and well-being in the workplace, and we talk about that impact on how we need to increase the priority for companies to really see the benefit of addressing mental health and mental well-being and really putting employees first. Can you tell me a little bit about each one of your companies, and when did your company first recognize that this was a critical topic for you? And can you tell me about how you were able to mobilize? Let's start with Danica.
Thanks. So I am the franchise owner of Chick-fil-A Drexel Town Square in Milwaukee, Wisconsin. Currently, I have about 115 team members, and I would really say that mental health has been an important part of my business for as long as I've been open. I opened about 5 years ago. Monday's our 5-year anniversary. And I think that for me, I really came in with it being a personal journey. I have struggled with my mental health for all of my adult life. And one of the reasons why I was so passionate about owning my own business was the desire to get to impact that in a positive way in a workplace. So really getting to be an advocate and ally for my employees on what it means to pursue holistic health in their lives, and also getting to showcase healthy habits, being open about my own journey about it, removing the stigma of what it means to be a leader, and also be somebody who has to work hard on my mental health. So.
Absolutely. And you said so much in that, like just so much about how there's this dual role that we have to be those examples within our workplaces, but also there's a stigma associated with that and from a leadership perspective. Really great insights. Melissa, can you tell us a little bit about your specific outreach and mobilization?
Sure. I work in our HR office, and several years ago, actually, we saw that we were having employees who were struggling with their mental health, and it was having an impact on their work. And oftentimes they were reaching out to their leaders and to their peers because that's their community. That's where they spend so much of their time and energy. And there was a level of comfort in opening up and sharing when they were in crisis. And so we began recognizing that the workplace was really shifting, and what employees were expecting out of their employer was different than just providing a safe workplace, but they were coming to work because of the holistic environment that we provide. And so we really began looking at how do we best prepare our HR and our security teams to be able to help employees when they are in crisis and they bring that forward to us. Because, you know, having been in HR for almost 20 years now, this was something that was new for all of us. And unless we had handled something on a personal level, we hadn't been trained on how to handle these sorts of issues in the work environment. And so we really partnered with the National Council, and we brought in several training programs, including first aid for mental health at work. And we began training our security and HR professionals so that we could help employees in crisis and really be that hand to help get them to where they need to get the support that they need. And also, we also recognize that because so many employees have such great relationships with their managers and their leaders, and they have that level of trust with them, they were coming to them. And oftentimes they too were also ill-equipped to be able to handle those conversations and felt uncomfortable because of the stigma attached to mental health. And so when that journey began, we really began opening up the conversation and helping to just remove the stigma, just as if we were to go and need some sort of physical health intervention. It's no different than mental health, and being able to have those conversations and having the confidence was really important. And that's really where we began our work several years ago.
Wonderful. Wonderful. That was really helpful, Melissa, to hear a little bit about, you know, training and education is but one piece. It's how do we look at this from a cultural shift perspective, right? And recognizing that not every environment is ready for that conversation. Not every environment has the tools. And so you mentioned bringing in mental health first aid and how that can help within the workplace. Taryn, your position is a little bit different and in terms of your approach. And so I'd like to hear, as you work with partners or others, in addition to internal to the company, what was it that kind of sparked that focus? And specifically, how did you mobilize?
Thanks, Tramaine. Well, I have to say, Melissa, we also did the mental health first aid at our offices a couple years ago, and I did the with some of my colleagues the 8-hour first aider training, and so effective, so helpful, so enlightening, and gave me such great tools. And so I just can't say enough good things about that. But from Kate Spade, New York, we're a global fashion brand based here in New York City with operations all around the world. And our mental health journey and how we thread it through our women's empowerment approach started about 8 years ago. I lead our social impact work, which is really centered and grounded in the empowerment of women. And about 8 years ago, we launched an initiative in Rwanda called On Purpose. It's a social enterprise initiative working to empower women that manufacture a line of handbags for us that we sell in our stores globally. And as part of that approach, women who worked at the manufacturing facility got access to not only economic empowerment, but mental health support and education services. And in 2017, Georgetown University came alongside of us and studied the impact of kind of taking the approach of providing a woman economic empowerment alongside what they were calling psychological empowerment, and found that she was in fact more empowered having access to both than if she would only have access to the full-time job. And so that was in 2017. And so in 2018, we lost our founder to death by suicide. And as a brand made a commitment to donate $1 million to mental health causes here in the United States. And that just connected us with really amazing organizations here in the US leading that work. It led to a connection to the National Council, the Jed Foundation, Dee Hirsch, really, really amazing organizations. And in 2019, We then fully embedded mental health into our women's empowerment focus areas. And so as we work with partners, both here in the United States and globally, we're looking to, really work with organizations that are threading mental health through the ways in which that they're working with women and girls in our communities. And it's actually been, it's been such a meaningful experience for us. I'm really talking about, the work that we're doing through our social impact work and outside the company, but we also have an internal community that's called Mind, Body, Soul at Spade. It's about 65 of us, both field and corporate staff that are super passionate about mental health and put on events throughout the company about mental health and well-being services and resources. So that's a little snippet into the inside and the internal piece too.
Absolutely. So there's this dual approach. And what I'm really hearing you say, Taryn, is you managed to embed this into not only how you fund and support projects externally in the organization, but also internally, ensuring that that external mission is also felt, that empowerment is also experienced by your employees, which is amazing. I think that is, just such a good transition to really what we're dealing with today. And we're dealing with not only internal to our workplaces, but also in our communities when it comes to social isolation. And so we hear that phrase, and I think before last year, we might have heard it differently and not at, kind of looked at this as a challenge that many of us were already facing. And then, by the way, COVID-19 pandemic, along with all the other impacts to our mental health, all of those things have increased. So I'd like to hear about your strategies to really focus on mental health and well-being in these conditions that have kind of emerged over the last year, or at least a light has been shined on many initiatives or, impacts over the last year. So how have you had to pivot as a result? What have you, from an engagement perspective, have you made any shifts and changes over the last year or so in order to deal with this new reality? And this is open to anyone who might want to answer.
I'm happy to jump in. I mean, I think one of the realities of being in the restaurant industry is that my team maybe didn't quite struggle with the isolation side of things, but they did struggle with being on the other side of our community's anxiety. And so really navigating that, I think was something that took us talking about, like, how do we manage when the person on the other side of our transaction is feeling the heat of what's going on? How do we acknowledge that the 30 seconds that we get with one of our customers might be the only time they interact with somebody outside of their house today? So how can we use that small moment to make a difference, to be a bright light in their day? And so when we really honed in on that and talked about the impact of mental health on our customers from potentially being at home and how it was our opportunity to be a positive influence, it was really cool to get to see my team feel empowered to take advantage of that, from little things like writing notes on bags and that sort of thing. But really what we find, right, and I think that a lot of people who struggle with mental health can relate to this, is that when we are engaged in walking alongside of other people, it actually is really helpful to our own journey. And so I found that the more we focused on bringing joy to our community and supporting our community as the community itself walked through COVID, it was really cool to get to see that support my own team and in their journey with the pandemic as well.
It's great.
Wow. Danica, I connect with that so much. Like the piece about, you saying the interaction that one of your team leaders might have with another human is like the only human interaction that person's having today. And I think that, we've definitely experienced that in many of our stores across the United States. And I think the piece that I would say more from kind of like just to add on to that, like the corporate citizenship, CSR, foundation leader perspective, an approach that we took this past year was also to really look for, partners who were able to offer the services that they were working to, empower women and focus on mental health virtually. And being open to conversations with grantees, with nonprofits about, hey, we got to take this virtual this year, and our funding and our partnership might look a little bit different because of that. And so we really created open channels of dialogue with our nonprofit partners, both here in New York City as well as in Rwanda. And we're as flexible as we could be with kind of, what the deliverables were under the current situation and how we could really help to empower organizations and leaders within those organizations to continue their work in this new environment and to really pivot to a virtual model. And I think like I was just like blown away at how quickly and how like impactfully and thoughtfully a lot of our partners were able to move to a remote offering to serve women in the communities where we live and work. So just kind of providing a little bit context from that perspective in terms of as a kind of like a funder CSR practitioner was like, okay, how can we help to, empower organizations that are out in the communities doing this line of work directly with more virtual offerings. And so that was really a focus of ours this last year.
I know for us, when I remember the date, like it was yesterday, March 13th was the last day I was in the office, and going that day thinking, oh, I'll probably be back in a few weeks, maybe a few months. And over the weekend, as we gained more information, it became very clear that this, like the world just kind of halted. And I remember it was a Sunday, I called up my security leader, who has really been a great partner for me in regards to getting our mental health focus off the ground at our organization. And I said, I know we're talking about COVID-19 as the pandemic. The second pandemic we're going to be dealing with is the mental health, especially with the isolation. So many of our employees rely upon, the work environment to provide to them that opportunity to connect. And not everyone has a family at home and people to connect with. I know for myself, I haven't seen my family in 15 months. And luckily I have family in my home that I get to see every day, but not everyone has the same network. And so knowing that we were going to be switching from 5% virtual environment to 95% of us working virtually every day now for over a year, I knew that this was going to be something that we needed to put some focus around. And, one thing that they always say is never waste a good crisis. And so good things can come out of a crisis, and being able to more openly talk about mental health at work has been a blessing, because we are able to reach more people. We're able to have more conversations. We've been able to have our CEO come out front talking about mental health and the importance and what we're going to be doing as an organization to support employees in this way has been a true blessing, because we've been able to get additional resources and to really just open up the conversation and continue to provide more and more great resources to our employees.
Absolutely. I mean, what I'm hearing all of you say is the pivot really meant different things depending on what the need was, right? That resilience that you all had to make those changes and willingness to shift priorities is something that we've seen happen over and over again. But I also hear that what are those tools? What are those resources? And how it could be writing that note, Danica, on a bag, or, changing the philanthropic, direction and making sure that flexibility is built in, or making sure that people know that they're people that care about them within the workplace, and changing that culture as well. So very, very specific things, that intangible things and takeaways that people can institute. And I know that they have done some. Maybe they're getting some new ideas from you all, which is amazing. I'd like to ask some specific questions now as we start to kind of move near our time of opening up the floor to all of our participants today. So please, as I mentioned, continue to put those questions in the chat box, in the Q&A box, so that we can ask those in a few moments. But Taryn, I wanted to ask you a question. I know you all are working with some amazing partners, and I know that you are really focused on, or have been over the last year, of helping the medical professionals on the front lines. You also were working with the crisis text line.
Yeah.
And so I wanted to know a little bit about how you're activating your partners. And as you're activating your partners, what are you hearing from them about mental health? Because there's this feedback loop that happens, not just you guys putting out that information, but what have you heard from your partners? And as you're working with them, give us some insights about what you're hearing.
Yeah. Let's see, it was probably about 10 months ago, we launched a partnership with Crisis Text Line called For the Front Lines. It was a crisis text line service support for frontline workers. We initially, when we provided them the seed capital, and the program grew pretty substantially after that. But that being said, we're a brand with a platform. And so what we were then able to do in order to get that information out and really share it more broadly, both the fact that it existed, but the specific number for frontline workers to use to get support, was to use our social media platform. We not only used our Instagram, our Facebook, we also used and partnered with a lot of the ladies and men that are influencers that we partner with throughout the year, and we're able to partner with them to help spread the word. So it was a great opportunity. And also I'll say our employees, it was a great way for us to really kind of use the social network that we have to spread the word about this really, really important service that was being offered by Crisis Text Line. And I'll say the other piece that, just specifically in answer to your question, Tramaine, about like what we're hearing, I think that, a lot of, we're really focused on, being able to really thread mental health and well-being into the ways in which we're supporting women and girls empowerment. And what we're hearing a lot from our nonprofit partners is there's not, to be able to kind of do economic empowerment alongside mental health, there's not a lot of places that, there's not a lot of opportunities for funding for that type of work. And so really bringing mental health into the mainstream for women, I think is really, really important, and to have resources available for organizations to try new programs, to try innovative ways of integrating mental health support into, existing programs. And so we've been hearing a lot about we're so excited to be able to try this now and to be able to integrate this into how we're working with women in our communities. So that's really reassuring.
Absolutely. So many good nuggets there. And it reminded me of Danica, just in terms of that feedback loop, that you're hearing great things about how can we and what can we do, and that framing from those that you're working with. And Danica, same question. What is it that, what's the response from your local customers and stakeholders or employees around really having this focus?
I think I'm just really grateful. I feel like I get to have kind of two opposite facing lenses to influencing my community, but then also influencing the industry, right? So like looking inside of my business and inside of my community, getting to see the impact. I get to hear from employees' families of, hey, it was really meaningful when you came alongside of us during that really hard chapter. Generational impact, right? Like if we can come alongside of a person who needs to do work to make progress in their mental health, the generational impact on their family, their kids, and what that could mean for their future is huge. We also see that in our community, right? Like how can we come alongside of organizations that are doing great work? How can we bring joy? How can we highlight great work that's happening inside of our community? I think additionally, getting to kind of flip to the other side is, what does it look like for me as a business owner to influence other businesses in my community? How do I show other business owners that it's not as scary as you think to open the door to mental health, right? I think that can, as a leader, that can seem really scary. Like if I open this Pandora's box, what will come out of it? But really like honing in on that idea that this is the same as if I had an employee who needed to go to a chiropractor once a week for back pain, right? Like the long term, I will have a better relationship with this employee if I support their holistic physical health. It's the same partnership with their mental health. And so just helping change that from a business owner perspective, getting to influence the franchising world, getting to speak into Chick-fil-A corporate and influence their thoughts on things. So I think that influence side of it, and really, again, removing the stigma, right? Like helping people see that it's not this huge, scary thing that kind of unfolds when you step into the waters of mental health at work.
Danica, I love what you're saying just about joy and like its connection to I love that. Like we did the Be Kind 21 challenge or campaign with Born This Way this year. We did it with our corporate employees. We did it with and our customer. It was amazing. It was like,
it's so great.
To spread kindness like that is such an act of not only, helping to improve somebody else's mental health, but also filling your own cup. And like,
I was actually shocked at how much, when my team members struggle with their mental health, they actually find joy and it's a part of their work to come to work. So
Yes,
it's like,
absolutely.
hey, I'm having a hard day. I have to come to work today because I get to make somebody
Yeah.
else smile.
Mhm.
And so it's crazy and when you talk about it, you create a culture where it's like, hey, I'm going to brighten your day and know that that's going to get passed around.
Absolutely. And not only is it wonderful, there's evidence and research that demonstrates that when you do this, there's this multiple layers of support and better outcomes for people when they're engaging with care when they need to, and better outcomes in their own mood, and that's reflected in how they interact with each other day to day. Melissa, this whole conversation that Danica and Taryn have, I'm like trying not to jump into every one of these because they're so good, but that definitely reminded me of your prioritization in the way that you were able to prioritize mental health in your organization. And so when it moved to the top of the list of things that your organization needed to address, how did your leadership really support that? Because we're talking about, Danica, Melissa and Taryn, you are leaders within your organizations, but then there's other influencers also sometimes, if maybe you're not the business owner or the person who's making the decision ultimately. How has your leadership been on board for that transition and that process?
Yeah, I would say for me, when we kicked off this work a few years ago, it was not easy. We really had to, just like anything else, show that put together the business case, show the data, show the metrics around why, what the prevalence of it. Unfortunately, because of the pandemic, this is something that we have been all talking about more openly. And so when we were looking to do more and to really mobilize around this as an organization, there was absolutely no resistance. So we were able to just start running and really talking to our employees who are all around the globe, and issues around the globe around mental health are very different. Stigma around the world is very different. And so you really have to be sensitive to the global sensitivities around this topic. And so we needed to find a way to help employees around the globe in a way that was going to be very impactful. And so we had the blessing right from the beginning to be able to do this work. And really, we pulled together a very diverse group of people to start putting together toolkits and figuring out what sort of training would be helpful. And oftentimes we had leaders coming to us saying, hey, I heard about this. Can you come and talk to our leadership team? We really want to lean into this. And that's where the momentum really started, coming from individuals who, recognized and were dealing with situations and saw that, it is okay to open up the conversation. It is okay to talk about this at work, because it is a time for us to really put ourselves first. And that was one thing that we really spent a lot of time talking to, both HR and our security teams, who are often frontline when it comes to employees who are in crisis. And the thing that we continue to focus on is self-care. I know that gets thrown around a lot, but you really can't service other people and be there for them if you're not taking care of yourself first. So really, really, that's one thing that I've really seen positive also come out of this pandemic, is people do have that time to do some more self-care because we're not commuting. We don't have, our schedules just look very different.
Yeah.
And so being able to put a very thoughtful self-care plan in place so that you can be of service to others was really important too.
Wonderful. And Melissa, I love that you're and Taryn, you're echoed there with the "you can't pour from the empty cup." One of our national trainers for the mental health first aid program really helped to solidify our understanding. And I always steal this quote and give credit where credit's due. But we typically will pour from an empty cup and give what we don't have to give, right? And so it's really important that self-care plan is done when things are well, and we're paying attention. One of the one of the tenets of mental health first aid is definitely ensuring that we are paying attention to self-care, but it's part and parcel of being a mental health first aider. So many good nuggets here, and so many good questions are coming in into the Q&A box. And I want to transition us to make sure that we can answer some of those. So really looking forward to having many of these answered as much as time will allow us to do. And so the first question has to do with mental health first aid. So I'll ask that question to all of you. How did you decide to go about offering mental health first aid, and how did you get connected? I can answer that, absolutely, but I figured I'd kick it over to you to answer as well.
Well, I can speak to that. So, really, we started looking into how can we best provide the resources to our frontline workers to be able to just have the conversation, because the role of a first aider is not to provide that service to them, but really to reach out, extend that olive branch to them, and get them the help that they need. And so when we started looking into that, we came across the National Council for Behavioral Health. And it was an exciting time because they were in the process of doing some revamping of some of their training. And we actually got to partner with the organization to help build that for our organization. So that was an exciting time for us.
Nice. Absolutely. And we transitioned to virtual. So that was part
Yes.
of what you're talking about, is that transition over and that pivot, right, that we had to make last year. And, so many folks have been recipients of the training, but so many people like yourself, Melissa, Taryn, and Danica as well are really focusing on mental health, which makes the program relevant, right? Having these open dialogues makes it even more relevant within workplaces, and important to ensure that people get the knowledge that they need and are comfortable in having these conversations. I'd like to also transition to asking a quick question around the sustainability. There's several questions. We have Kathy, who asks, what changes will you keep for your staff when this is all over? All and this can be defined in so many ways, right? There's so many things happening right now. Danica, why don't you talk about what are some of those things that you're going to keep as we move into maybe not the environment we're in today?
I think for me, I have viewed the business each year as caring for my team. I'm adding layers to it. So I don't actually see anything going away. We expanded our EAP access this year. We did some small things, like we added into our monthly one-on-one template. Most of the time our team is getting to rank how they're doing with their personal goals, their family, their health. And we actually expanded health to include mental wellness. So we just give them an opportunity to talk to us about it. They're not required to, it's not a report out, but it just gives them a small door to step through if they're able. And that, I think, has been the most meaningful change that we would never take back now. And it's just a small little action item that really kind of opened the door to more conversations.
Absolutely. So there's another question in here. I think that this will be great for you, Taryn. Sabrina asks, what can female members of the workforce do to push our companies to take a more inclusive and accepting approach toward mental health and see more resources implemented in our day-to-day?
Oh, Sabrina, that is a good question. I think, I'll kind of piggyback a little bit off of what Melissa was saying. There's definitely kind of the business case, right? And the importance to kind of lay out the facts. And unfortunately for women, our trajectory is not going in the right direction. You see women leaving the workforce at greater degrees than men. We have increased care work that's happening on the home front globally, increased levels of burnout, increased levels of stress and anxiety, particularly in the Gen Z and millennial generation. So the facts are the facts, right? And unfortunately, we're not headed in the right direction right now. And so I think that's a big piece of it. I think the other side to it too is understanding, what is the meaningful contribution that either the organization can make in this space or I can make in this space right now? And it looks different for everybody. You know, there is, I think, a really mental health and well-being it's such a vast sector, but it's also such a massive problem in our country, in the United States in particular, that it's going to take like a lot of organizations and a lot of people tackling it from a lot of different angles. So I think that the question of asking yourself, all right, what is the meaningful contribution that our organization can make to the mental health and well-being space, and where do we think we can, you know, whether it's one step forward or a couple steps forward, or one program that you're going to pilot and then, you know, have the intent to scale. It also takes time, and that's okay. I feel like we've always also been in a culture where it's like, you know, in order for me to make impact, I got to quit my job, go live in my parents' garage and like start this brand new thing, you know, like, and it's like, you know, meaningful change can also be gradual, and that's also okay too. So I just share that because I think that it's so important that like this issue isn't, you know, it's going to take a lot of organizations, a lot of people, a lot of strong hearts to tackle it. And there's lots of different ways that you can get involved and make a meaningful contribution.
Absolutely. Taryn, man, you said so many things that I want to like unpack, but it's time. So one of the things that I think was important was, you know, you don't have to have the answers internal to your organization, and nor do you have to start from scratch, right? I think that this conversation today between all three of you, we're hearing so many ways that we're approaching some of the challenges that we face. I heard it said that we're all in the same storm, but in different boats. And so one of the things that's important to recognize is that this impact to women, this impact of all the environmental stressors, COVID-19, everything that is happening impacts women much differently. Also, it impacts communities of color very differently. It might impact individuals that are in rural communities, and depending on your connectivity to broadband, that is going to be a different impact. And so depending on where you are as an employer, so important to recognize that you can start somewhere and do something tangible that someone else might be doing. So these are great ideas that you're sharing today. I'm so grateful for those. And we have some amazing questions still left here. So a couple of them kind of focus in the same area. So I'm going to ask this question of you all. And it really is about how do you really decrease the stigma and increase the conversation within the workplace when the organizational culture doesn't seem to be quite ready to have these conversations, right? Everyone is not just open to talking about their mental well-being. And often individuals might be in an environment where that's not the typical conversation that happens. So what's that first step someone might take in an organization to kind of shift that understanding and be more open to having a conversation around mental health?
I think one simple thing that we all can do is, you know, oftentimes I remember, you know, walking the halls at work, how you doing? How you doing? No one even waits for you to answer the question. And usually you hear the same response. I'm fine, I'm fine, I'm fine. And you can tell someone's not fine. And so it's just taking that pause and just looking them in the eye, even if it's via video, and just genuinely from your heart, ask them, how are you doing? And if you sense that they're not okay, be honest with them. Say, you know, I've been struggling for the last week too, you know, and, you know, here's some things that I've been doing, you know, how can I help you? And just opening up the conversation from that place of just sincere curiosity around wanting to know how they're doing and wanting to be of service to them as a person that you really deeply care about. I think it's as simple as starting off with changing that small behavior and how we start every meeting, how we start every conversation that we have.
Melissa, I think that that's really important. I think I would agree. And I think that that's probably been the biggest change I've seen is, you know, just being willing to have the conversation. I think I've seen in the comments and in some of the questions that some of the people in our with us today also struggle with their mental health. And I think that for those of us who have struggled with it, like, you know, the power of when somebody took the time to notice. And so I think that as often as we can do that, it's important. I also think that for those of us with positions of influence, being willing to go first. If our company isn't ready for the conversation yet, we can do what we can to change that. I I have been known to speak about mental health anytime somebody at Chick-fil-A hands me a microphone. And so whether it is relevant to a topic or not, I have been in a supply chain meeting and talked about mental health, so like it kind of like, if you're willing to make it a platform, it can come up at some point. And then over time, in the 5 years that I've had my franchise, like I've seen that be at first what felt like maybe an awkward conversation to every time it's ever come up, having somebody message me afterwards and be like, I thought I was alone. And I'm so grateful that you were willing to bring it up. And so I think that being willing to take the first step when you're able is the most powerful thing you can do.
Love that. Oh my goodness, so much good stuff. Really, really helpful and tangible. And so, I see some other questions around here. It's not just the mental well-being of the day-to-day when it comes to what we understand to be mental health, right? A part of mental health might be related to something like substance use, right? We've seen some increases of substance use over the time of COVID-19. Are any of you familiar with or know of resources that organizations might want to reach out to, or maybe you know of initiatives of how people are also addressing these increases in substance use among your employee base or the communities or partners that you work with?
I know one of the resources that we really leverage quite a bit in our organization is really encouraging our employees to use our employee assistance program. Most organizations have one, and oftentimes the services that they provide are often misunderstood. And oftentimes there's this sense that the company's going to find out that I'm calling, the company's going to find out that I have a substance abuse problem, or I'm struggling with my mental health, and what's that going to mean for my employment or for my ability to continue to grow in this organization. And so oftentimes just like you, Danica, I use every opportunity when I get a mic to somehow try to talk about mental health. And part of removing the stigma is being able to talk about it, whether it's about my own struggles or the struggle that my child had last year when school went virtual. And so continuing to just have the courage to talk about it, any opportunity that you get is really important. And I oftentimes will let people know, I don't know if you're aware, but I've used EAP myself when I was looking for childcare, or when I was struggling with something financially, or someone in my family needed help and I didn't know what to do. And so oftentimes, instead of just encouraging people to call or utilize a resource, I will also oftentimes plug in how I or a peer, and I won't give their name, used it and how it was very helpful. So really being able, it kind of just takes the scare tactic away that, oh, you used it, therefore it's safe. So I also encourage people, use the resources that you have. I have a really hard time recommending something I'm not using myself. So
Absolutely.
I myself with these resources by using them myself too.
Absolutely. I think it's critical to recognize that. I know for National Council, we represent 3,300 mental health organizations that provide physical health services, mental health services, substance use services. And so you can go to our website, nationalcouncil.org, and see providers that are there that provide substance use services, but also those EAPs within the organizations that you're talking about. So critical and so useful and necessary, and there's a partnership often between, I know when we provide mental health first aid at work training, we make sure we talk about those internal resources that you're already using to embed training into the fabric of this larger initiative. So we got a minute left and lots of questions left. And I'm sorry we couldn't get to everything. However, as we wrap up, if you could think of one thing, each of you, that one takeaway or recommendation that you have for companies that are listening today, take about 20 seconds each and let us know what that one thing would be. And we'll close out for today.
I'll start. I think what I'm walking away from this conversation with is two things. One, the importance of embodiment, the importance of, like if we're going to talk about this, that a really effective talk about mental health and push the mental health agenda. One of the most effective ways to do that is to practice it yourself and to talk about your personal experience when you're ready and when that feels right for you. So that's one thing I'm walking away with. And I think the second thing I'll just say, especially given this is a women's conference, is just the importance of filling your own cup. This is a marathon, not a sprint. And it's so incredibly important to fill your own cup so that you can push forward on the agendas and the programs and the partnerships that will create more change for others. But you got to have your cup full first.
Absolutely. Full cups. Melissa and Danica?
Sure. It's hard to pick one or two, but I think the first thing that I would encourage people to do is just have the courage to use the voice that you have. You absolutely have the ability to influence others in just starting the conversation. That taking that first step is the hardest, but it's the one that creates the most momentum and will get you started. I would say the second thing to do would be, I think it's really important to have as many mental health allies and ambassadors as you possibly can have in your organization. And so multiply them by providing them with mental health first aid training, for example. And that's one way that you can build more allies across the organization.
That's great. Great. Danica, last one to wrap us up.
I think my final encouragement is just that it's okay to feel ill-equipped and to lean in anyway. That you will find yourself in a conversation where all you can really do is listen because you don't know what the answer is. And that's still a great first step. That's still a worthwhile thing to lean into. And so that's just my encouragement, is that, we definitely will have moments that we don't know what to say, or we even say the wrong thing, but it is better to take steps forward than to not.
Absolutely. Well, thank you all for your great insights, your willingness to share some amazing work that you're doing in your own companies. And hopefully people have walked away with a good understanding of where they can get started to stand up for mental health. Thank you so much to all the participants for being here. We appreciate you and we look forward to you staying well, staying healthy, and standing up for mental health. Have a great day.
Thank you, Tramaine.
Thank you.